then Karin, onto COVID secure environment, and we'll go on for 5 more minutes if that's okay.
Okay, thank you very much, Roland. I just want to focus on 3 areas today, but first of all, I'd like to extend my thanks to the COVID Secure Task Force that continue to meet on a regular basis, and they really take into account and mull through what the community picture is, transmission rate, what happens internally and also in wider society. And you'll know that, and hopefully all staff know that we've got a portal with lots of information. And some of the key messages from today we will ensure is repeated in the staff bulletin. So previously the risk was the impact of disease and illness and isolation. And we've heard today from Sani and Sue around vaccination and the transmission between vaccinated staff. So the risk has now shifted to isolation and the impact of services and staffing. So we are now softening our approach in a deliberate and considered way, and we always said from the start that our approach has to be more cautious than wider society. So the 3 areas I want to focus on is the working environment, what we're now saying around training, and importantly around events. So in the working environment, we continue with wearing masks, social distancing, good hand hygiene, and good hygiene overall. And we are not expecting to see droves of staff coming back on site. For many staff, working remotely is now the new norm, and we expect that to continue. And staff should continue and teams should continue with a rota basis. We have, as part of our package of signage and risk assessment, we have signs on meeting room doors to say the maximum number of occupants. So we're saying face-to-face meetings can occur, although we recommend that virtual meetings continue. But if you are meeting face-to-face, you have to continue to maintain social distancing and the maximum occupancy stated on the door. And you have to really consider how staff feel about being on site. And if you can't offer a hybrid solution for those people who are off site who feel uneasy meeting face-to-face, then virtual meetings have to continue. So it's really important that local teams take responsibility for how they manage in their area, really carefully considering all of our colleagues. In terms of training, we have up to now restricted the training to essential mandatory training only. We're now saying that all training and education can proceed, but again, it has to be risk assessed and it has to be with the COVID secure measures in mind, and the maximum occupants are really quite important. And trainers are also encouraged to think about how do the staff get to the area? Do they congregate outside of the training room? Do they congregate again when they leave? All of that has to be part of the planning, and it's your responsibility as a trainer to ensure that is well managed. We're also encouraging all staff to use lateral flow test ahead of a training event and continue with the PCR testing. It is the member of staff attending the training's responsibility to make sure they've undertaken that lateral flow testing, and all of the COVID secure restrictions are maintained. And so turning to events, again, we are providing a framework for people to make decisions, and it's really important that individuals and individual teams take responsibility for their own actions. So we are saying that people are asked to carefully consider why we are here and the impact on our patients and fellow staff if suddenly staffing are affected and we can't deliver service. So external events, proceed with caution, but keep these considerations in mind. On-site events, it has to be managed with a risk assessment and in a COVID secure way. Same applies as for training. Drop-in sessions, they are not permitted because they encourage gathering and they're unmanaged. Things like cake stalls, that's a no for the moment, and we'll review that again in the new year. And I just want to say 2 other things. I know people are fatigued with the one-way system, and I have to say at 6 o'clock in the morning, all I can do is just think I want to make just the quickest journey to buy my coffee. But even at 6 o'clock in the morning, I have to think I set an example for all that use the hospital, and it instills confidence from our patients and also our staff. So please stick with a one-way system. Hopefully it won't last forever. So I'll pause there and say that we will wrap all of this up in the updated guidance, and we will make sure that staff are updated via via the daily bulletin. But this is really a responsibility of local managers, local staff, in how they plan the events, whether it's outside gatherings or on-site meetings and other events. Thank you, Roland.
Lovely, Corinne. So again, really clear presentation and summary for us, and also the follow-on as to where we're going to get the information. So I think what we really heard there, Corinne, was, I mean, I heard three things. So the first thing is, in broad terms, we're in quite a confusing scenario, aren't we? And the first point would be, what's going on in society, in our communities, is a massive easing of restriction and freedom of movement. And then what you're saying is, and that's what we're experiencing every day, is what we see as we walk around the streets. Then the second big point you're making is, look, in the hospital, we heard this from Sani and Sue and Giles, we're in a different environment. We're looking after people who are often profoundly unwell, and we know that if we get this wrong, it can become incredibly challenging for our patients and our staff. So we have a different set of requirements in terms of working in the National Health Service and working at Cambridge University hospitals. So when we come to work and when we're at home, it's different for us, just as it's different for lots of people in different parts of society. But this is the thing that's different for us. And what you're saying, Corinne, is the COVID Secure group are saying, look, we thought about the balance here very carefully. There's a package of measures coming out, and please read those. Please have a good look at them. And I think the third point you're making, Corinne, in this is very powerful, which is it's up to all of us as grown-ups to read that and then internalize and really think what will be best for me, my team, my family, and my patients. And to use the same judgment that we've all applied throughout COVID, which let us do, in very testing circumstances, really well by our staff and our patients. So you're saying, yes, society is different. It's different for us in CUH. Here's the package of measures, but the biggest thing is read it, internalize it, and use common sense. And I think feel free to put your hand up and say to colleagues, I'm not so comfortable with the way this is going, and that's okay. And we should all just feel free to look to the left and the right and say, that doesn't feel quite right. Is that a fair summary of what you're saying to us?
Yes, perfect.
Lovely. Okay, good. So Corinne, thank you so much for that, and we'll look forward to seeing the content on the bulletin. And as you're saying, that will evolve. Good. So we're a bit over time. Tony, thank you so much. Thank you so much, all colleagues. Really terrific to see you. Very rich conversation. Look forward to seeing you around the hospital. And in the meantime, have a really terrific week and enjoy yourselves. Lovely. Goodbye.